Hi there, my name is Lindsay Tretnero. I'm the Overdose Prevention Outreach Nurse for Northreach Society in Fort McMurray. So today I'm just going to talk a little bit about opioids, give you a little bit of background education, some statistics, and we'll go into naloxone training following that. So these are our services, and they have temporarily been modified to maintain our social distancing and keeping as little contact between each other as possible. So we do education. We're geared towards treatment pathways, HIV and STBBI support, and LGBTQ focused learning. So this includes opioid awareness, needle distribution and safer inhalation kits, outreach services, safer sex supplies, take-home naloxone program, which includes training and kit distribution, care support, and counseling. So we do have an addictions counselor on staff. So if anybody was needing to talk to somebody, she is doing over the phone counseling, and she's working on doing some video services right now. So we're going to go into the basics about opioids, talk a bit about fentanyl, where opioids are being found, and how it has been impacting First Nations communities in Alberta. So what is an opioid? Opioids are a class of drugs that work on areas in your body called receptors that relieve pain. And those same receptors also control breathing. So that's why the overdose from opioids is often recognized by a lack of breathing or a slowed breathing because it works in those same areas. So they're a family of drugs used mainly to treat severe pain. It can also be used to treat a severe cough or diarrhea, addiction to other opioids, and it's used when other medications have been unsuccessful. So these are some of the opioids you might recognize or have heard of before: codeine, hydromorphone, morphine, heroin, methadone, oxycodone, fentanyl, and carfentanil. So opioids are derived from or a synthetic version of opium, which come from the opium poppy. Morphine, the most abundant natural opioid found in opium, was used for years as a pain reliever. And as medicine advanced, we found ways to replicate the effects of morphine to make it stronger or weaker, depending on the need. Some opioids, like methadone, were developed due to a scarcity of morphine, while others, like heroin, were made in an attempt to make less addictive drugs, but would later be made illegal to produce. Today, opioids are almost synonymous with pain relief. So legal versus illegal opioids. Legal opioids are prescribed by a healthcare professional, most often to treat pain from conditions such as injury, surgery, dental procedures, or long-term chronic pain. Illegal opioids are any opioids that are made, shared, or sold illegally. Illegal opioids are going to include street drugs from a drug dealer, opioids given to you by someone who is not your healthcare provider, opioids that are not prescribed to you but are taken from someone else. So when you think illegal, that's going to be things like heroin, counterfeit pressed pills. Yeah, so that's what would be included with that. So what is the opioid crisis? We've heard about opioid crisis, opioid epidemic. It's a complex public health issue. There are many factors that led us to the significant increase in opioid-related overdoses today. Some of these factors include high rates of opioid prescribing and the emergence of strong synthetic opioids in the illegal drug supply, such as fentanyl and carfentanil. So what is fentanyl? Prescription fentanyl is a powerful opioid pain medication, causes higher rates of respiratory distress and overdose. Most product is imported, so meaning it's coming in through other countries. There is medical diversion, meaning people misusing medications, but for the most part, it's because of stuff coming in from outside the country. So fentanyl has a really high concentration, so because of that, it's very easy to smuggle. So you only need a very small amount to go and do a lot of damage, and it goes very far, and it's very easy to conceal. So today there are a number of fentanyl analogs or slight variations with harsher effects on the body being introduced with no prior or current medical use. These are some of the common street names you can see there. So it's up to 100 times more potent than morphine and 50 times stronger than heroin. So when we talk about legal versus illegal in terms of fentanyl and the safety of it, legal would be created in a controlled lab environment in the form of patches, injections, or lozenges. The doctors determined the benefits outweigh the risk of opioids, but there is still a risk. Even in a clinical setting, they have what they need on hand in the instance that there is an overdose still. Illegal, it's created in a non-sterile environment, often in basements, garages, or bathrooms, and the end product has unknown amounts in each pill. So one pill may not cause overdose where the next might. So like there might be a hot spot within that pill. So if, say, somebody crushes up a pill, they're sharing it amongst a few people. One person might be fine, the next person might be fine, and the one after might overdose off the same pill because they hit a spot that had more in that one particular spot. So what is carfentanil? It has also been found in substances that have been seized by police. It's a big game tranquilizer. It's not approved for human use, so it's intended for animals like elephants, rhinos, hippos in like a veterinary setting. It's 100 times stronger than fentanyl, 5,000 times stronger than heroin, and 10,000 times stronger than morphine. Very powerful stuff. So you can see here, these are the lethal doses of each substance on the left here. So with carfentanil, it only takes that small little amount there to cause an overdose, a fatal overdose. Fentanyl, still not very much, and then heroin. And on the right here, this is a picture of a seizure of illegal pressed fentanyl tabs. And the other thing I wanted to mention too with the carfentanil and the fentanyl, when it is being laced into other substances, it's very difficult to detect it. It's not something that can be smelled or seen or tasted even. It's something that you would not be able to tell it is in the substance until it's too late. So drugs that have been found laced with fentanyl, cocaine, methamphetamine, LSD, marijuana, benzodiazepines, and ketamine. Fentanyl has also been found pressed into counterfeit pills and branded as Xanax or Vicodin. So with marijuana, it might not be as common now, not that it was very common before, but with marijuana being legal now, it's a little bit safer. But before, and of course there is still a black market for marijuana, but if somebody was dealing more than one substance, say marijuana and fentanyl and cocaine, and they're weighing all their things out on a scale, they weigh their fentanyl, they weigh their cocaine, then they weigh their marijuana, and there's a lot of cross-contamination going on, and then somebody that is intending to just use marijuana is ending up smoking fentanyl. So opioid-related overdose deaths in Alberta. So 801 people died in 2018 in Alberta. 458 people died in 2019 in those first 3 quarters in Alberta. So to put that in perspective, on average, approximately 90 people die of the flu and 300 in motor vehicle crashes per year in Alberta. So you can kind of get an idea in comparison with each other. So fentanyl-related overdose deaths in Alberta. So you can see that the numbers just kind of went right up, and you can see in 2018 there were 671 deaths. So what I was talking about in the prior slide, that there's 801 deaths that year. Of those 801, 671 of them were fentanyl related. So you can really see that it's fentanyl that is the main issue here. There are other factors, but fentanyl is the one that's causing the most damage. So in Canada overall, with the opioid-related overdose deaths, more than 13,900 apparent opioid-related deaths occurred between January 2016 and June 2019. 4,588 deaths occurred in 2018, and in 2019, between January and June, 2,142 deaths occurred. So it's affected every part of the country, more so in BC, Alberta, and Ontario. And the age and sex groups vary in the different regions, but majority is young adult males, middle-aged and young. So some of these numbers might actually be, in fact, higher because opioids can be hard to disentangle from other factors in a death, including different drugs and underlying illnesses. So the numbers can be a little bit skewed, and it can take a little while to determine the manner of the death. The opioid epidemic among First Nations people in Alberta. This is according to the Alberta Opioid Report, I believe accurate as of December 2019. First Nations people represent approximately 6% of the Alberta population, yet they represent 13% of all opioid poisoning deaths from 2016 to 2018. Among First Nations people, carfentanil, methamphetamine, and fentanyl saw the largest increase as a substance causing drug poisoning death from 2016 to 2018. Benzodiazepines, oxycodone, morphine, and codeine all saw a decrease of more than 50% as a substance causing drug poisoning death from 2016 to 2018. 41%, down from 61%, of individuals who died from an apparent accidental opioid toxicity and identified as First Nations had an opioid dispensed from a community pharmacy in the 30 days prior to death, compared to 22%, down from 35% among non-First Nations. So you want to learn the name of your medications and why you're taking them. You want to know how often, how much, and how long you should be taking your medications. How long, especially so you don't continue taking it unnecessarily. You want to know the side effects of your medications and what you should do if you begin experiencing them. So if one does occur, that it doesn't scare you and you know what to expect. You want to know your limitations while taking the medication. So you want to know if you're able to operate a vehicle or carry out duties at work or home safely while taking the medication. You want to know what to do if you miss a dose. It's important because each medication can be a little bit different. Some are take when you remember, some are just to skip it and wait for the next time dose, some are take 2 at the next dose. You want to learn what foods and drinks to avoid with your medication. So that's something you can discuss with a pharmacist. I will provide an example of this in a couple more slides here, but that's something to be mindful of as well. So you want to keep medications in their original containers. Never mix different medications in the same container. Safely dispose of all expired or unused prescription medications. There's take-back programs at pharmacies, and these can help prevent medicines like opioids, sedatives, and stimulants from being misused. And the program also helps keep medication from contaminating soil and water when thrown in the garbage or flushed down the toilet. You want to keep medication, prescription, and over-the-counter in hard-to-reach locked containers for the safety of children and pets. So it's important to be involved in your own healthcare plan and recognize options for controlling pain. So just knowing that medication isn't the only option out there and that you do have the right to speak up if you feel something isn't right for you or you don't feel comfortable taking something, and just recognizing that there are other methods out there, including massage, traditional cultural methods, physical therapy, counseling, and just therapy. So you want to talk to your doctor about what would work best for you based on your medical history. So some other safety measures for when someone is prescribed an opioid would include taking it as prescribed for the predetermined length of time, not sharing medication or using someone else's medication, being cautious and double checking with a doctor or pharmacist before taking other medications with an opiate, and not consuming alcohol with opiates because you get that depressant effect. If you have any health conditions such as cancer, diabetes, high blood pressure, it's important to inform your health team if you're thinking about using traditional healing, as well as letting your Indigenous healer know your diagnosis before certain ceremonies. Most ceremonies are safe, such as smudging or healing circles, but dehydration or heat exposure from sweat ceremonies could be harmful if you have a health condition. This is why it's important to let your health team or healer know in advance so they can accommodate you. It's also important to check if there'll be interactions between traditional herbs and Western medications before taking them at the same time. And some hospitals or health centers have access to an Indigenous liaison that can help connect you with a healer or an elder. So the current liaison coordinator at the Northern Lights Regional Health Center is Tina Grant. She works through the Athabasca Tribal Council, so you can access her information through the ATC website. She works to help Indigenous individuals navigate the hospital local services to ensure the highest quality service and confidentiality can be provided to those clients through her. So some overdose risk factors include just using substances such as opioids that increases the risk for a fatal overdose, unknown substances in a legal product, so the dealer and producer mixing various amounts and opioids together, mixing alcohol and prescription or non-prescription drugs, mixing various drugs together, for example, an upper and a downer, such as cocaine and heroin at the same time. Grapefruit and some antibiotics can affect the way the body breaks down opioids, which leads to more of the drug entering the blood and can then lead to an overdose. So we talked about this a little bit earlier with the medication safety. So just being aware of what's okay to take with your medication, just following the guidelines, and if you're unsure, just making that phone call to the pharmacy. So some ways to prevent an overdose are starting small, low and slow, especially if changing routes or after periods of abstinence from use. So that if somebody goes to detox or they're just not using for a little while and then they go back to their substance, they need to make sure they're not using that same amount that they used before because their tolerance has changed. Or if they're changing routes, so if they went from smoking it to injecting it, they need to not be using that same amount again, going low and slow and just taking it very slowly. Never using alone. That's a big factor for people, and overdose deaths, they end up by themselves, so nobody even knows they're overdosing. So it's important that they have one other person that at the very least knows. Knowing what you're taking and who you're taking it from, having a naloxone kit ready and making sure that you and others using with you know how to use it. Using clean equipment, so using like our needle exchange or safer snorting or inhalation kits. Wearing proper personal protective equipment, such as in the kit there's gloves and there's like a one-way valve mask, so that would be what that's referring to, and checking surroundings and items you're handling, and that would be in regards to when you're using a naloxone kit on someone, just being aware of everything around you so you're not inadvertently kneeling down into something or touching something that could harm you. So what not to do when responding to an overdose: do not slap, punch, or kick. Induce vomiting, give any other drugs, let them sleep it off, or put them in a bathtub or shower. So as far as like letting them sleep it off, for example, if they have an opiate in their system, say they've been drinking, combining substances. So we have our opioid, which is a depressant, we have our alcohol, which is a depressant, and then when we go to sleep, our respiration's naturally lower because we obviously don't need as much oxygen when we're sleeping. So those combined on top of each other and you let them go to sleep, that's when they might end up overdosing. You don't want to give them any other drugs because that could just complicate it further. You don't want to induce vomiting because they could inhale their vomit and end up choking, or yeah, they could. You don't want to put them in a bathtub or a shower for that kind of same reason. You don't want them to inhale water. So naloxone is used to block the effects of opioids. So the onset, or how long it takes to start working, is 2 to 5 minutes. So it takes this long to knock opioids off the receptors and bind in their place. So I like to think of those receptors, like we talked about it a little bit earlier about the receptors and what they control, pain and breathing. So I like to think of those receptors as like a golf tee. This is going to be our golf tee. So that's how long the naloxone takes, that 2 to 5 minutes to knock the opioids off those receptors. So the opioids have come and they've plugged up these spots. Too many of them have come along and plugged up too many of them. So now this person isn't breathing anymore. The naloxone in 2 to 5 minutes comes along and knocks those off and allows that person to breathe again. However, it only sit there on those receptors, keeping the airways open for 30 to 60 minutes at a time. And that's going to depend on what the person took, how much they took, the size of the person. There's a lot of factors in place for how long it'll stay. But so that's why it's really important that the person, if they do wake up after you've given this to them, that they stay there and wait for ambulance to arrive. Because one, it's only a temporary fix. They still need to go to a hospital. It just kind of buys time. And two, because it's going to wear off soon. And if they leave before seeing an ambulance or getting to the hospital, it could wear off and they could start overdosing again. Or the other side of that is that they might want to leave to go and use again, because as you can see there with the side effects, one of the side effects is immediate opioid withdrawal, depending on what the reason was for that they were using the substance. But if they have an addiction and they are going through withdrawal, they might be quite upset, agitated, and want to leave and go and use again. So within reason, use your judgment and see how safe the situation is. Try and talk to them and explain that to them, that if they leave, nobody will be able to find them, that they will start to overdose again, and if they use more, that will only make things worse. So it's important to also note that naloxone will not harm someone who is not poisoned or overdosing from something other than an opioid. So if you see some of the signs that we're going to talk about, maybe even just one or two, but you're not too sure if you should be giving it to them, you just give it to them. If you're wrong, it just won't do anything. Nothing will happen. This is what's inside each kit. We have 1 pair of gloves, 3 alcohol swabs, 3 3-milliliter syringes with retracting 23 gauge 1-inch needles, 3 single-dose vials of naloxone, and 1 CPR protective barrier mask. Inside there's also a step-by-step guide included in it. And also, if you forget any of the steps along the way here, the 911 operator will definitely walk you through what needs to be done. So the first thing you want to do is scan the area for sharp objects, needles, body fluid, blood, powdered drugs, and you want to put the gloves that are inside the kit on right away. If you come across a situation and you suspect that this is what's happening, put those gloves on right away. This slide and the 5 following it are going to be how to respond to an opioid overdose and use your naloxone kit if needed. So step 1 is to look for the signs of an opioid overdose. Not moving and can't be woken, slow or not breathing, blue lips and nails. The darker the skin tone, the more kind of purplish or gray that might appear. Choking, gurgling sounds or snoring, cold or clammy skin, and very tiny pupils. So you might have to actually kind of lift the person's eyelid and have a look, and you'll see very tiny pinpoint pupils. So if you see any of these signs, go to step 2 and call 911 immediately if you have not already. Step 2 is checking for a response. So you want to speak very loudly and try and get a response out of them, shout out to them. If that doesn't work, they're not responding to you, you can take your fist and you want to rub quite hard in the middle of the chest. There's that bone right there. You're rubbing firmly right there to try and get a pain response out of them. Before you put your hands on them, maybe just kind of say, I'm about to put my hand on your chest to try and get you to wake up, just letting them know what you're doing in case they can hear you. If you can't get to this spot for some reason, they're wearing something really thick and you cannot get there, you could also grab this muscle here and do a twist. It's called a trapezius twist. It's like right in that area right there, that kind of muscle there. If there's no response, again, if you haven't called already, call 911 and move on to the next step. Step 3 is, are they breathing? So you're looking to see if their chest is rising and falling, seeing if you can hear them breathing. If they are, you want to put them into the recovery position. You want to roll them onto their side so that their hand supports their head and wait for help to arrive. And you stop right there. And you just kind of monitor the situation and carry on from there. If they're not breathing, then you start the rescue breathing and you tilt the head back and lift the chin. So over in the corner here, you can see the steps for giving that rescue breathing. So you want to place the mask in the mouth. You can see the instructions for placement on the mask. I'll show you quickly what this mask looks like so you can get an idea for it. So it looks like this when it's opened up. Okay, so there's a one-way valve inside of that. So one side goes into their mouth, this side goes into their mouth like that, and then you're pinching the nose through this and tilting their chin back and doing the breaths through this. So you're pinching the nostrils closed, tilting the chin up with the head back, and giving one deep, slow breath into the mask every 5 seconds for 2 minutes. So about 24 breaths. And you're just watching for that chest rise. If they're still not breathing after going through that, then you go on to step 4. Step 4 is preparing the naloxone. So I'm just going to pull out my kit here and show you how to draw up here. So we have our syringe and our naloxone vial here. So as you can see in the picture there, just the cap just flips right up like that. In the middle there, there's like a little rubber membrane like that. So what you're going to do is put that on a flat surface. You're going to open this, kind of like a Band-Aid. It just kind of peels apart like this. Remove the cap. So you're on a flat surface. You would not do this in your hands, but just so you guys can see, it goes straight into the middle. Okay, and you want to keep the tip of the syringe or the needle down low in the vial, because if it's up too high, then you're just going to suck up the air. So we're just going to make it so that's nice and low. Then you're just going to slow and steady draw it up. If you don't get all of it, like every drop doesn't come out, that's totally okay. You don't have to measure anything. There's the amount that is needed is just in the bottle. You just suck up as much of it as you can. Okay, so you might be left with quite a lot of air. You're just going to push that up until you get like a little droplet coming out. Okay, so this is going to be our person. We'll go to the next slide here and it'll show you where to inject it. So injecting naloxone, the best place is going to be in the thigh, as you can see in the picture there, in that kind of upper thigh area is the preferred site. If you can't get to that spot for whatever reason, if they're wearing extremely thick pants, you just cannot get to the thigh, you can also put it in the shoulder. There's like a little bone at the top there, about 2 to 3 fingers below that is where you're going to inject it. You can inject this through pants, so like tights, jeans, anything like that. But if they're wearing like really thick pants or snow pants or something like that, you might want to consider putting it here if you can't get to that thigh spot. So we have our syringe already filled. This is going to be our person, I suppose. So I'm just going to put this up high so you guys can kind of see. So we're holding it like a dart. So we're kind of putting it in like that and going slow and steady. I just want you guys to see when you get to the end, you want to make sure it clicks and you can see what happens when you get to the end. So you can see that the needle retracted inside the barrel. So it's like a safety feature so that you don't poke yourself. So the final step is repeating all the steps that you just did. So you continue the rescue breathing, you repeat steps 3 to 5 until help arrives. If they wake up, you remain calm and explain that help is on the way. So you're doing the breaths, you're drawing up a dose, you're giving it to them. You're doing the breaths, so you're basically doing the breaths while you're waiting for the naloxone to kick in. So breaths, dose, until you run out or until they wake up. Obviously, you don't want to continue if they have woken up. Just something else to keep in mind that I realized I forgot to mention in the last slide is that when you are injecting, you don't want to just put the tip of the needle in. You want the whole thing in because it's a muscular injection and it needs to get quite deep. You need to put that whole thing in there. So the Narcan nasal spray, it is not part of our take-home program. However, I just wanted to mention it to people so that they were aware of what was available to them. It's quite expensive from pharmacies. I believe it's $140 to $150 for 2 doses. If you do have a treaty number, you can get these for free, but I would suggest calling ahead of time and making sure they have it on hand, that they understand that that is covered through NIHB. So just something to consider. It's a lot easier to use, a little more user-friendly. So yeah, just something for you guys to think about. So if you have any questions from any of the slides today, feel free to reach out to me, or if you have any questions about our other services or a supply distribution, you can email me at naloxone.fm@northreach.ca. Or our most active platform is our Facebook page, so you can also reach out to all the staff there. Our outreach number is also on that page, so you can contact us in any one of those ways. Thank you guys so much for listening and getting through all this, especially in these crazy times. I really appreciate it, and I hope that we get to see each other soon.